this is so I can describe it hopefully within 10 minutes. Getting ahead of the curve. Recent disquieting infectious disease trends have not gone unrecognized, and their similarity to earlier disease trends with immense global consequences has not gone unnoticed. All right. It says recent disquieting infectious disease trends have not gone unrecognized, and the similarity to earlier disease trends with immense global consequences has not gone unnoticed. Meaning the disquieting infectious disease trends where they're trying to keep it quiet with delusional parasitosis and get you to believe that it's not real, that it's all in your imagination. Okay. The recent disquieting, them doing that, has not gone unrecognized. It means we recognizing the bullshit. And the similarity to other disease trends with immense global consequences has not gone unnoticed. The fact that it has the symptoms globally and the consequences being the symptoms that it's causing to be familiar with other patients that have it has not gone unnoticed. Primary responsibility for addressing new and re-emerging infectious diseases rests squarely with the custodians of public health. Indeed, the fundamental maximum of public health must guide current prevention programs. Okay, current prevention of emerging diseases. It's not in order. The future of public health emphasizes the relationship between a sound public health infrastructure and infectious disease prevention programs. See, infrastructure improvements must become a national priority. Certainly, they are among CDC's top priorities. Improvements in infectious disease surveillance are particularly needed. Our capacity to generate, integrate, and disseminate and apply knowledge will determine the human prospect in the 21st century. Okay, their capacity to generate, all right, integrate, and disseminate. They generate it, they integrate it into society, and they disseminate the information. Clearly, broader coalitions are needed and communication must improve if we are to get ahead of the curve. This new periodical is part of the overall strategy to draw worldwide attention to emerging infectious and improve communication. Given the multiplicity of factors contributing to disease emergence, the multiplicity of factors is the fact that it's not been unrecognized and it's not gone unnoticed. Disease emergence, emerging infectious disease will present relevant concepts from professionals in multiple disciplines and disseminate information, like I just said, about emerging infectious diseases, not re-emerging and emerging infectious diseases, in order to develop and apply ecologically acceptable interventions. Ecologically acceptable interventions that will benefit humankind. That means control it to where, basically ecologically, in a global perspective, humankind is fucked. There's too many of us here. Prevention and control of new and emerging infectious, not re-emerging, new and emerging infectious disease depend on the participation of scientists and other professionals in the public and private sectors. Prevention and control of new and emerging infectious diseases. Okay, prevention and control of new and emerging means they don't want it fucking out yet. The need for implementing CDC's plan is urgent, given the extreme dynamic nature of trends. The complexity of factors contributing to disease emergence, these were outlined in detail. Let's get that, all right? This is their plan. Detect, all right? They detect it. Promptly investigate. They investigate the detections. And monitor emerging pathogens, the diseases they cause, and the factors influencing their emergence. See that? That's why you're going to have a history of loss before every disease. They monitor it first. It's the first thing, surveillance and response. Then they apply research, integrate laboratory science and epidemiology to optimize public health practice. Then they prevent and control, enhance communication of public health information about emerging diseases, and ensure prompt implementation of prevention strategies. I mean, they've noticed it. They got to prevent it from coming out. Infrastructure. Strengthen local, state, and federal public health infrastructures to support surveillance and implement prevention and control programs. They prevent it from coming out. Federal and public health infrastructures in state, all that, local. Microbiologists, infectious disease specialists, and other basic and clinical scientists must collaborate with behavioral scientists in an interdisciplinary effort to prevent and control emerging infections. We cannot overstate the role of behavioral science in our effort to get ahead of the curve with emerging infections. Having the science of laboratory technology to control infectious disease is not enough, unless we can influence people to behave in ways that minimize the transmission of infections and maximize the efforts of medical interventions. Medical interventions being part of the prevention and the control. Okay. Agent-specific surveillance is a critical component of many immunization programs. Vaccines to and influenza type B, for example, were developed in response to laboratory-based surveillance. New infectious diseases, often with unknown long-term public health impact, continue to be identified. Do you know why that is? This is often with unknown long-term public health impacts, because they monitor it for a while, continue to be identified. It means the disease is going on right now. The new infectious disease that they're trying to prevent from the emergence being noticed and recognized is continuing to be identified. The Morgellons disease, that is not a Morgellons. It's an actual disease. And the thing about all this shit is, right? Do not be distracted by the patient's interpretation of cause. Do not be distracted by the patient's interpretation of cause. It means don't pay attention to what they're telling you caused this parasitic outbreak that they believe they've got. Don't pay attention to the symptoms that they're describing. Pay attention to the history and consider alternative conditions that can cause similar symptoms, not alike symptoms, not identical symptoms, not familiar symptoms, similar. Pay attention to the history, as in use their fucking drug use, medical condition, history, and all that stuff, and consider alternative conditions. It means consider something else. Don't even be distracted by their interpretation of the cause. Consider something, alternative conditions that can cause similar symptoms. Review records, including all medications, both prescribed and over the counter. Obtain basic laboratory studies and thyroid function and sediment rate. Consider hepatitis and HIV testing, syphilis, serology, toxicology, vitamin deficiencies. Send specimens brought in for formal analysis. Allow the patients to choose the best example, so they feel like they're being part of their health coverage. This is real shit, y'all. I don't know if you understood any of that or not, but I got the actual document on PDF, and I will send it to you. All you got to do is request for it.
It's an emotional meeting. These people from all over the country all suffer from a baffling disease, including the youngest patient, this little 3-year-old.
Everything about this is not normal. It's going to be really hard.
Mother and daughter say they are both afflicted.
I'm just scared. Very scared.
It's called Morgellons disease. The origin is unknown. What's truly bizarre, the disease produces strange fibers that emerge from the skin.
The X-Files, it's nothing short of that.
The symptoms are painful and even creepy.
The itching was so bad that it was painful.
Stinging, biting, crawling.
Using magnifying devices, they comb their bodies, examining what they say are outbreaks of the disease.
There's one. You sit and you wonder what on earth could cause this.
And that's the big question about Morgellons disease. You see, most doctors don't recognize it as a disease at all. They say people who claim to have it are delusional, conjuring up parasites, scratching themselves, even planting textiles like cotton on themselves to feed the delusion.
I've had 17 visits with doctors over the past 3 years. All of them, except one, have basically laughed at me.
Nicole says doctors first thought her daughter Ashley had severe diaper rash until the lesion spread to her face.
She constantly thinks that there are bugs on her. And that's what it feels like. It feels like things are crawling underneath your skin.
I don't think these patients are crazy.
At Oklahoma State University in Tulsa, Dr. Rhonda Casey believes Morgellons is a genuine illness and takes precautions when examining Morgellons patients.
We don't know yet whether it's contagious.
Dr. Casey said all her patients exhibit the same types of lesions and scars. She says they are definitely not self-inflicted.
They all appeared to be eruptions more than scratched areas on their skin.
Dr. Casey has taken numerous fiber samples and says they're unlike anything she's ever seen.
They are not textile. They are not any known substance.
Dr. Casey was amazed by the mysterious fiber on Brian's hand and decided to have it tested. She tugs on it, but the fiber holds firm. Finally, it comes loose.
We took the whole plug of skin with it.
Dr. Casey and her colleague, Dr. Randy Wymore, take the samples to Tulsa's crime lab.
Morgellons fibers are not any known textile, cotton or rayon or nylon, not any of those.
What's more, the fibers don't burn when exposed to high heat.
Have you ever done a fiber that didn't vaporize completely other than the Morgellons fiber?
No.
Many in the medical community are nonetheless skeptical, but people who say they have Morgellons are desperate.
Look at the evidence. That's all we ask. Look at the evidence.
Amen.